how you know a person is having a seizure. You just see the person staring blank into space, and you see the person having like involuntary or automatic movements of their body, jerking of the lips or of the eyes, twitching, or full-blown jerking of the entire body. What you do, if the person is standing upright and the person is about to fall, you have to guide the person quickly to gently lay on the floor, and you remove any dangerous objects like boiling water or any sharp objects away from the person. You tell people that are standing around to move back, and you place pads around the person to avoid injuries to the person's body. What you don't want to do is you don't want to constrain the person, you don't want to restrain the person from these jerking movements. Then afterwards, you check the time when the seizure starts, and you place a pillow or a rolled up towel on the person's head, and afterwards you allow this, when the seizure goes down or ceases, you place the person in a recovery position and call your local emergency number.
CPR is basically cardiopulmonary resuscitation, and you perform CPR when a person has collapsed or when a person isn't breathing. So to perform CPR, it's quite easy. All you need to do is follow some steps, and there's a mnemonic to help you remember what to do, which is doctor's ABC. D stands for danger. Make sure you are not in any kind of danger. You or the person involved is not in any kind of danger. Then if it's an accident victim, it will be better off to remove the person from the place of accident, lay the person on a flat floor, and if the person has any tight clothing on, you can remove the clothes. Then we move on to R, which is response. You can shake the person's shoulders for response, or you can ask loudly, are you okay, or are you alright? And if there is no response, then you move on to the next, which is S. You shout for help. At this point, any help will be very, very important. Then you can go to A. A is for airways. To check for the airways, you tilt the head backwards and upwards. Then when you can see the mouth, you check if there is any obstruction. Then you move to B, which is breathing. To check this, you look, you listen, and you feel. You look for chest movements. You listen for normal or abnormal breath sounds, and then you can use your face to feel the person's breath on your face. And if there are abnormal breath sounds or there is no breathing at all, then you can move to C, which is circulation. Normally, circulation is done for us by our heart, but in this case where the heart is not able to do this, then we can move to compressions. We have to perform 30 compressions and give 2 rescue breaths. So to perform compressions, you place the heel of your palm in the middle of the person's chest, place the other hand on top and interlock your fingers. This is for adults. Make sure your arms are straight and your elbows are also interlocked. Then start your compressions. Make sure your compressions are hard and fast. Hard in the sense that it has to be about 5 centimeters deep, and then fast in the sense that you have to give about 2 compressions per second, because if you give less or more, it might not be as efficient as you want it to be. Then if you are comfortable or if you're a trained personnel, then you can give 2 rescue breaths. For this, you have to tilt the person's head upwards, use your hand to raise the chin, pinch the nose, and then give slowly and deep breaths into the person. Then also, to know if this is working, you can check for chest movements. If you don't see any chest movement, there might be an obstruction or you might be doing it wrong. Then if you don't see any chest movement, then you might have to redo this again. Check if there's an obstruction. If there is any, you can remove, and then if the head is tilted wrongly, you can tilt it back and then start the breaths again. Then in case of children older than 1 and adolescents, you use just one hand, use the heel of one hand to perform the CPR, the same 30 compressions and 2 rescue breaths. In the case of infants, you use 2 fingers from one hand to perform these compressions, but it's still the same as 30 compressions and 2 rescue breaths. Sometimes we have D, which is defibrillation. In some recreational centers and in some sports areas and in some restaurants, we have AEDs, which are automatic external defibrillators. These are quite easy to use. they basically do the compressions themselves, and it's even easier because how to set it up and everything is written there, and it will help you to even set it up itself. Then you need to perform, if there are no defibrillators, you need to perform this CPR until the person regains his consciousness, or until the person starts breathing normally, or until professional help comes. In case you get tired, you can call for help for another person to help you to start the compressions, but you shouldn't stop.
Assess the situation. If the person can still cough, then you encourage the person to keep coughing. If the person cannot cough, you have to act quickly. So what you want to do is you have to check the person's airways, and if you see any obstruction, you can see it in the person's mouth, you do a sweeping motion with your finger and to clear off this obstruction. If the person still has something lodged in their airways, you go behind the person, you lean the person forward on one hand, and with the other hand, with the heel of your palm, you perform 5 blows to the back between the person's shoulder blade. This is done for an adult and children, but for an infant, you have to place the baby's face down on one arm, supporting their head with your hand, and you use the heel of your palm as well, and perform 5 back blows between the shoulder blades. But prior to this, you have to call your local ambulance. For adults or for children, you go behind the person as well. You clench one fist. You make a fist, and then with the other hand in front of the person, you place your hand between the navel of the person and between the lower part of the breastbone, and make sharp and quick upward and inward movements 5 times until the obstruction is cleared or until professional help comes. For children, you place the baby to face forward, and you support the baby's head as well. You use one hand, 2 fingers, and place beneath the lower part of the breastbone, the baby's breastbone, and make 5 chest thrusts. And you also perform this until help comes or until the obstruction clears. Do not stop until the obstruction clears. Thank you.
Well, what actually happens in your hair is that a lot of sebums and oils get trapped in your hair, so that makes the hair really greasy and quite heavy. So how to prevent that is by washing and shampooing your hair thoroughly and conditioning after. We wash our hair by massaging the scalp with shampoo about 3 times. So you rinse it out then with water till the color of the water goes clear. Then you condition your hair. After that, you dry your hair with a towel, and make sure to then put in moisture back into your hair with hair creams and hair lotions. So another major thing to remember is to prevent lice. So you do this by not sharing brushes, not sharing combs, and maintaining the distance. Yeah, exactly.
We can care for our face by washing our face twice in the morning and also at night. And we also can care for our face by making use of moisturizers after washing our face. And it's also important for us to make use of sunscreen. And for the ladies, it's important for us to note that after applying our makeup, at the end of the day, we should make use of wipes to clean our
makeup.
Yes. It's important for us to clean our makeup with wipes, and also it's important for us to keep personal hygienes and like changing our bed linens and making sure our place we sleep, where we basically place our faces, are kept clean.
So change like pillowcases.
Yes.
I think that we can also use silk spreads and silk pillowcases as well.
Yeah.
So that would definitely be acne and body odor.
Yeah.
So in terms of preventing acne,
In terms of preventing acne, like I said earlier on, wash our face regularly. Make use of different face towel to clean our face. You don't use the same towel you use to clean your body to clean your face. And making sure we keep our hands away from our face, because hygiene, like we're talking about, is very important. So when you're touching things around and you're still taking the hands back to our face, it causes acne. And it's also important, like I think many of us might not know this, but we can make use of warm water to wash our face. This is going to help to open the pores in our face also.
Yeah. And I would say that after you do open your pores, make sure you do close your pores back with using cold water. Okay, so the thing with body odor is actually caused by bacteria on the skin. So in order how to basically treat that is using medicated soaps, so antiseptics and all of that. So basically shower with that and rinse with water. Dry yourself with a clean towel, and then afterwards you moisturize. Use deodorant, antiperspirants and perfumes as well in order to smell nice and smell fresh. And make sure to change your clothes daily. Like, don't repeat clothes that are smelling off, obviously change them.
Like we know, the teeth has 5 surfaces: the top, the side, the front and the back. So it's important for us to wash this part of our teeth, and in doing this we can wash our teeth 2 times daily, when we wake up in the morning and also at night after our last meal. It's important for us to brush at least 2 to 4 minutes, yes, every time. And it's also important for us to use floss, because we can't, the toothbrush can't get into those part of the teeth.
Yeah, the side.
So yes, so the floss helps us to get to the side of the teeth. And it's also important for us to make use of toothpaste that has fluoride to help washing our teeth. And very, very important thing for us to do is to wash our tongues, because the tongue is where most of the bacteria are being stored in our mouth. So this can cause mouth odor and everything. So it's very important we spend time washing our tongue.
Well, with the ears, you have to remember to scrub your ears, or wash your ears rather, whilst you're in the shower. The back of your ears, make sure to always wash them. Now, medically speaking, they do tell us not to put anything into our ears in order to clear the earwax, but there are some specific things like solutions you can actually use in order to clear the wax. For example, that would be hydrogen peroxide, or some oils specific for earwax.
To care for our nails, we can care for our nails by trimming it down. And when we are trimming down our nails, we should make sure we don't trim to the skin level, making sure the skin surface is still safe. And it's important to also file our nails and basically just file the rough surfaces of our nails also, and clean out every dirt out of our nails too.
So with your feet, make sure whilst you're in the shower that you wash your feet. Make sure to wash in between your toes. Do not do it too vigorously. Make sure just something soft, little scrubbing here and there. Also, they do sell some foot scrubs that you can use to scrub your foot, the back of your foot and so on. And definitely moisturize. Give your foot some tender loving care.
And it's important for us to change our socks regularly.
Yeah.
Don't repeat socks. And if you have to, wash it before you have to wear it back. So just keep good hygiene to your legs. So it's also part of your body. So take care of your legs.
And make sure it's dry.
Yes.
Damp socks are bad for your feet.
As ladies, we require special genital care because we are special beings.
To wash our genital areas, we only need to use clean, plain water. Avoid the use of soap, intimate gels, or herbal concoctions.
Also, we should avoid douching and to reduce the risk of infection, and also to reduce the risk of cancer. .
Yes, as ladies, it's very normal for us to have vaginal discharge. The normal vaginal discharge has a whitish color and a small odor, but it's not offensive.
If you notice any abnormal discharge, abnormal color like greenish, yellowish, reddish, brownish, or it has a cottage-like feel, or it smells like a fish, you need to report it to your gynecologist.
First of all, you should shave your vaginal area, your pubic area generally. You should shave it to avoid excess accumulation of hair, which will lead to accumulation of sweat and predisposition to infections. Also, after urination, ensure that you use clean tissue paper to clean your vaginal area from the front to the back, not from the back to the front.
To avoid infections.
The normal menstrual cycle varies from woman to woman, but from 21 to 40 days is considered normal, an average of 28 days. The duration of menstruation is from 5 to 7 days.
In case you're experiencing any abnormality or severe pain, absence of menstruation, in case you're having heavy flow, it's necessary to see a gynecologist to check for any abnormalities or any disease.
Well, when you're on your period, you can either use pad or tampons. I'd advise you to use pads anyways. You should change your pads every 3 to 4 hours to avoid overflowing and smelling bad.
Also, you also need to change your pants regularly. It's necessary to change your pants every day regularly. Have your bath and keep that area dry, because if it's wet or humid, it can breed infections like we said earlier. Also, you need to change your bra consecutively for 2 days. Don't use your bra more than 2 days. Try to change it, like interchange it with other bras. And if you sweat a lot, it's necessary to change your bra every day to avoid some breast issues. Disposing your pad properly is very important. Please try to wrap it properly or use a nylon bag to wrap your pad before disposing, so as to avoid people seeing it. It's not proper for people to start seeing your used pad everywhere.
Well, breast examination should be done about 7 days after the beginning of your menstrual period. This is because during other times in the month, your breast can be swollen for different other reasons. But at this time, it's easier to detect lumps or asymmetry or irregularities. So the best time to perform breast examination is 7 days after the beginning of your period. If you can do it every month, actually it's best, because the main aim for doing breast examination is for early detection of lumps, which can be benign or malignant tumors, and early detection is the best way for treatment. So you should do it as often as possible.
It is necessary to see your gynecologist immediately if you detect any abnormality, any change in skin color, any patches or any lump. It's necessary to see your gynecologist immediately, who will do some physical examination and ultrasound to know if it needs to be removed or if you just need to undergo some conservative care.